About 2016, we noticed, after having a fairly small staff, that our numbers of patients were growing. The number of ED admissions, ED visits was going up to the point that it was actually twice in 2017 what it was in 2014. We also noticed that people were staying in the hospital a little bit longer. So all the metrics that one would use to judge the quality of care for patients with sickle cell disease were going in the wrong direction. We did a lot of analysis. We put pen to paper about the kinds of staff we needed, and we made a proposal to the hospital to develop what we're calling the adult sickle cell medical home.
Care in the United States healthcare system is often fragmented. And when care is fragmented, it leaves patients to coordinate their own care. And unsurprisingly, in that kind of system, patients have poor outcomes and often feel unsatisfied with the care that they receive. And that's especially a problem for people with sickle cell disease. And so I felt that we had an opportunity at VCU to address those challenges. I reached out to Dr. Smith several years ago when I recognized that there was an opportunity to improve coordination of care across the department for patients with sickle cell disease, because he's long been the leader of our sickle cell specialty clinic. And so we've been working together for about 4 years now to try to improve and try to build the medical home.
These adult patients with sickle cell disease nationally are neglected because this was a childhood disease where suddenly the patient started living longer because of good childhood care. You know, treating a child with sickle cell disease really is focused on helping them survive childhood. You are talking about strokes and infections that kill children. Treating patients in adulthood is about treating pain, because the patients develop early failure of major organs from poor blood flow because of the sickle cell disease. And that's a totally different animal than treating children.
When we first started the project, we looked at guidelines to see how we could improve our care based on expert and evidence-based recommendations. And one of the things that we found was that we needed to make sure that when a patient presented to the emergency department in a pain crisis, that we were getting them adequate analgesia in recommended timeframes from triage or from registration.
And so what we've seen over the past 6 years is just this really growth of the clinic. So we actually have people that can help with getting patients' medications filled. We have social workers, we have somebody that can help us on our research side, and then just having patient navigators. So just having somebody that can actually talk to the patients, be with the patients through the whole process, whether it's in the emergency room, when they get admitted in the hospital, and when they get discharged and go home. Being able to say that we have a clinic that is able to touch that patient along that spectrum is very new to us and really is exciting.
We hired our team, including our clinical social workers, our patient navigators, our inpatient nurse practitioners, somebody who helps us with prior authorizations for our opioid medications, which is a really significant thing that many times would lead our patients coming to the emergency department just because they didn't have their medication. So the team has been in place for about a year now, and as a result of that team being in place, we were able to do the savings that we talked about.
With any chronic disease, you're bound to have kind of these social and behavioral aspects that affect your care. So they're crucial to not only the program, but to the patients.
Yeah, a lot of these patients wouldn't be doing as well as they are without their involvement, so it's huge.
And the patients agreed with us. You can see patients smiling more when they came to clinic now, feeling even when they came to the emergency department and to the hospital like, oh, somebody knows me. And there's an individualized care plan there for them with their name on it, so that the physicians there, even if they don't know the patients, have something to refer to. Oh, you're Dr. Smith's patient. This is what we're going to do for you. It gave the patient a lot of relief. It gave the physicians a lot of relief. They didn't feel like they knew what to do for some of these patients, especially with regard to opioids. And you know about the opioid epidemic. It is rampant now. And these patients are really not a part of that. Their need for opioids was legitimate. Their use of opioids was high, but people were suspicious. And so this removes some of the stigma, removes some of the suspicion around needing opioids and using opioids, especially in the emergency room and in the hospital setting.
2020 I think will be exciting because our hope is that there's going to be a new infusion drug getting approved pretty soon. We can offer any new drug that comes available, and that's the future of sickle cell disease.
I've been incredibly surprised at how quickly the patient-centered medical home has been able to improve outcomes for our patients. In only 2 years, they have decreased inpatient days by over half. They've dramatically decreased readmissions and length of stay, and most importantly, the people involved in caring for our patients and the patients themselves feel that our system is the way that it should be, that we're able to provide care that's not just focused on someone's disease, but really the whole person, and I think that's a wonderful thing.
I would really like to continue to see the success of the patients that we feel are in homeless situations and continuing to work with the community to try to get them into stable housing and help them to become more successful in their quality of life, which in turn then should help them stay stable with their disease.
I don't know how many patients have told me, I feel like I'm actually getting really good care. You guys know what's going on, you talk to each other, you help me out, you call me, you check on me, and I feel like no matter where I am in clinic, the ER, inpatient, you're gonna be there. Hey, how are you? What's going on? How can we help?
So from my perspective, I think I'm really looking forward to where the program grows, new patient navigators, new staff members, and I'm really excited to see the future for the sickle cell program.
My number one excitement for this program is the patients feel human. They feel cared for. It's an adult sickle cell medical home. A few patients have been cured with bone marrow transplantation. We look forward to genetic engineering to cure our patients in the near future. We have a program and a research protocol that we're opening there. And we're doing research to disseminate our results to the research community and to hospitals around the country so that they can replicate programs like ours. Celebrate life and lessen the pain. Celebrate life and lessen the pain. And that's what we're doing, making the pain diminished and helping people become able to live a healthier life.